And when the bombs hit, doctors and nurses at one Boston hospital had new insight on exactly what to do, due in part to the Aurora theater shooting. And new tonight, 7 News reporter Marc Stewart live at University Hospital in Aurora with the lessons they shared. Marc?
And the response that happened here is now helping others to save lives. This was the scene on July 20th. Cars literally dropping patients off one by one. What happened that night is now part of a learning tool for other hospitals. Moments after the marathon bombing, when the injured came here to Brigham and Women's Hospital in Boston, the staff was already well prepared.
People running out of the theater, they're shot.
They had been studying the response to the Aurora movie theater shooting. They knew cars lined up here at CU Medical Center. 23 wounded people came through that night. In Boston, Emergency Chair Ron Walls knew 23 needed to be their new threshold.
We raised our game. We elevated our game because of what had happened in Colorado.
The day of the bombing, the Boston hospital also had 23 patients.
Can you take care of 23 patients in a very short period of time, in the course of an hour? And we were able to deploy multiple teams and have that readiness.
During and after the chaos in Boston, Dr. Walls was on the phone getting advice from Dr. Richard Zane in Aurora.
Emergency medicine and acute care medicine is a small world.
Dr. Zane used to work at the same hospital in Boston before moving to Colorado.
We all share the lessons that we learned, and we also check up on each other.
Emergency medicine is a changing science. The response in Boston was in part dictated by the events in Colorado.
So we had to be ready for an unmanageable number. And it was really the lessons of Aurora that helped us to get ready for that.
And the team here sharing their experiences around the world, sharing what happened that night to doctors all across the globe. Live in Aurora tonight, Marc Stewart, 7 News.